Thank you. Welcome, everyone. I'm so glad that you joined us this evening for our official movie premiere. It's our red carpet night to celebrate World Kidney Cancer Day. I hope everyone has had a good day. It certainly was beautiful weather in most of Canada, so I hope that you were able to enjoy that. We're just waiting for our board chair to join us. I think he'll be along in just a minute, but I'll kind of briefly introduce who is on your screen that you can see, and we'll give more formal introductions later. I have Deborah Grant, who is our patient that will speak this evening. I have Alex and Alex is from Minogue Medical, and we have Dr. Stephen Pautler, who is our star doctor who did the videos for us, and we're so glad that you all could join us. I just wanted to bring attention, I'm sure many of you have seen it in the media today, that this is going to be the 1-year anniversary for when the pandemic was declared. And you may have noticed that there's been several memorial services held across Canada, and just taking a moment to remember how much our lives have changed over the last year, and to remember those that we have lost with the COVID virus. There have been many, and I don't think anybody has been really untouched in one way or another. So we just want to remember this day and take note, and then we can move to our happy celebration of World Kidney Day. I guess Andrew is having a little difficulty joining, and I am going to go ahead, if you don't mind, and kind of welcome everyone to our red carpet event on behalf of Andrew Weller. Andrew Weller is our chair of Kidney Cancer Canada, and he feels that the presentation today embodies all the pillars of Kidney Cancer Canada: support, education, advocacy, and research. With your generous support, Kidney Cancer Canada awards seeds money to research projects that lead to new technology and treatments, although not specifically to this Da Vinci robot. Once the research is approved, we advocate on your behalf to implement and fund these breakthrough treatments. Through our peer support network and website, we help direct patients and caregivers for the best treatment path available and provide education through webinars and forums like this one today. Kidney Cancer Canada's board, staff, and volunteers are made of patients, caregivers, and healthcare professionals that are truly here to support you, our kidney cancer community. So we thank you very much for joining us for this event today. I think that this is maybe the first. Our Video Knowledge Library is certainly known worldwide and provides excellent information for any patient and caregiver that has questions. We try to do our best to answer all of them. And I hope that you will take the opportunity to tune in, especially after our newest additions are loaded, and they'll be loaded probably by next week so that you can take full advantage. I'm going to introduce, I wanted to mention that this was all made possible, this video, through a collaboration with Minogue Medical. Robert McKenzie from Minogue Medical reached out to me, and we were talking about how we might work together. And I think, Alex, you will agree that you've taken on quite a patient initiative, and that you are very interested in patient education and support. And so we have this wonderful collaboration. It has been a positive experience all the way through. I want to give a shout out to Craig Davis of Producers Post. Craig was our videographer, and as you will see very shortly, you will see what an excellent job he did putting that video together. Like, it is top notch. Alex is our spokesperson tonight from Minogue Medical. So welcome, Alex. Thank you. And Alex is the Surgical Robotics General Manager at Minogue Medical. He graduated from U of T as a professional engineer, and Alex and his team of specialists are responsible for installing, maintaining, I'm sure there's lots of other things that they do for the Da Vinci surgical robotic systems across Canada. They also provide clinical support and training to hospital staff, including surgeons and nurses. So certainly a very valuable service, and we are grateful to Minogue. So thanks for all your help. Minogue supported us with funding for this opportunity. I'd like to also briefly introduce Dr. Pautler and Debbie Grant, and ladies first. Debbie is a registered practical nurse and a Kidney Cancer Canada volunteer. She has 31 years experience working in the operating room at St. Joseph's Hospital in London, Ontario. Now, I don't think all your time was there, but 26 years, I think, Debbie, wasn't it?
26 at St. Joe's. I worked in Toronto.
That's great. Wow, you've really probably seen just about everything.
A lot.
Deb is also a stepmom to two adult girls and a grandma to a beautiful granddaughter. They love animals and they have a large collection of pets. And you can see one of, I guess, two there, Deb, of your fish collections. Your hubby has a fish store, I believe.
He does.
Yeah, that's pretty cool. They're certainly beautiful.
Thank you.
And I'd like to introduce our star of our videos, and it's Dr. Stephen Pautler. And Dr. Pautler, after, if you may indulge me for a moment, I'll read your short bio, if I may. After graduating and becoming a fellow of Royal College of Physicians and Surgeons, Dr. Pautler spent 2 years at the National Cancer Institute in Bethesda, Maryland, and performing both clinical and basic science research in minimally invasive interventions for urologic cancers before joining the staff at St. Joseph's Hospital, St. Joseph Healthcare in London. An assistant professor with the Department of Surgery at the Schulich School of Medicine, Western in July 2002, and Dr. Pautler has been cross-appointed to the Department of Oncology a few years later. His current interests include surgical robotics and urologic laparoscopy with the application of minimally invasive surgical techniques and image-guided ablative procedures for urologic cancers. He is a Canadian expert in hereditary cancer syndromes and is a member of the Kidney Cancer Research Network of Canada. Dr. Pautler has been one of the pioneers in surgical robotics in Canada and has much experience with prostate and kidney surgery performed robotically. Dr. Pautler is the Southwest Regional Surgical Oncology Lead for Cancer Care Ontario, Ontario Health, and as well as the Provincial Lead for Urology Access to Care, Ontario Health. He has been the director of the Endourology Fellowship Program, and he participates in the Society of Urologic Oncology Fellowship Program at Western. So, sir, you are definitely qualified to join us this evening and give us your expertise. So I think without further ado, I think that we'll show the movie, if you don't mind. Don't panic, everybody, get comfy. It's about 8 minutes or so long, but I promise that you will get lots of information, and it is visually very appealing as well. So I hope you enjoy our movie premiere of The Robot. And afterwards, we'll join again with Deb and Debbie and Dr. Pautler, and they will possibly discuss what this has meant to them and maybe answer some questions from the audience if they don't mind. So Mona, without further ado, could we start the movie?
Minimally invasive surgery simply describes a technique a surgeon may use to perform a surgery through small keyhole-type incisions. There are a variety of minimally invasive surgeries, and when we're talking about kidney cancer, it most commonly applies to radical nephrectomy and partial nephrectomy. It's a tool we use during minimally invasive surgery to perform the task at hand. So we're doing essentially the exact same surgery as we would with open surgery, just through keyhole incisions. The robot facilitates more complex maneuvers by the surgeon. The robot has several components. So there is the actual robotic cart with the instrumentation that's hooked to the patient. There's a vision cart, which has a computer processing unit and a high definition screen. And then the surgeon actually sits at a console, usually an arm's length from the patient, and is doing the surgery in the console by manipulating end effectors, which then allow the robotic instruments to do that task inside the patient. The surgical robot that we're using can actually scale our movements, and it basically miniaturizes our hand down to about 7 millimeters in size. So you can do complex tasks, and I can be actually more precise than I can be with my own hands during open surgery. In my opinion, robotic-assisted surgery is as safe as any other type of surgery. It does come down to the experience and the judgment of the surgeon. So when there are complications, it's related to patient factors, sometimes tumor factors, and sometimes surgical factors. The robot has no increased risk above other standard operative risks that a patient would be subjected to. There's always the potential during minimally invasive or minimally invasive robotic surgery to have to convert to a standard open operation. There are instances where there's difficult dissection, inability to properly cut out the entire tumor with a clean margin, or instances of bleeding or injuries to other structures which may then warrant conversion to open surgery to complete the operation. That risk is low, but it is present in all cases. Robotic surgery is not for every patient. There are reasons why we cannot perform robotic surgery for some individuals. Examples include prior surgery in that area of the abdomen can complicate things and make it much more difficult to do minimally invasive surgery. There are factors with a person's kidney cancer that may preclude using a minimally invasive approach and warrant a standard open surgery approach. One of the great advantages of the robot is a small wristed instrument, which is fitting through the same portal. So that gives us an advantage. Another advantage with the robot is three-dimensional vision. So the surgeon actually is able to see depth, which is lost in standard laparoscopic surgery. The robot does facilitate reconstructive maneuvers during surgery. It basically allows us to sew in a very straightforward manner, a manner that's intuitive to the surgeon. Laparoscopic reconstruction is difficult to do, and it's a high complexity task. There's really no difference in the anticipated recovery with minimally invasive surgery, except less pain, likely less risk of a wound infection. Certainly during surgery, bleeding is less likely to occur with minimally invasive approaches, although partial nephrectomy is a procedure where there is a significant risk of bleeding generally about a 5% risk, but that does vary based on case complexity. The minimally invasive approach, both standard laparoscopic and robotic surgery, there is less damage to the tissue, so people do tend to recover faster, resume their normal activities. There's a number of questions a patient can ask. For example, what is the clinical stage of my cancer? In other words, how large is it? How complicated or involved is this tumor? Is there a need for reconstruction of the kidney, which is performed in partial nephrectomy? Surgical robotics helps with that for surgeons. So another question a patient could ask their surgeon is, do they qualify for surgical robotic approach, and would there be an advantage? And the surgeon's experience will come into play. It's not for everyone, and it may not be offered for everyone. So it is something you can ask. If the surgeon doesn't perform robotic surgery but deems it appropriate for this patient's case, could the patient be referred to another surgeon who does have access to surgical robotics? So another question a patient could ask their surgeon is about recovery time following the proposed surgery. Typically, open surgery does require a longer recovery than a minimally invasive approach. So as with any surgery, trying to eat well and exercise is important. It's a term we call preconditioning for surgery. If someone is a smoker, they should try to stop smoking, which would greatly benefit their recovery. There are other aspects to the preparation for surgery, such as mental health and anxiety. So Kidney Cancer Canada provides support and education for patients. The patient's family doctor and surgeon may also provide support. There may be instances where someone needs a stress reduction program or other things such as mindfulness and meditation, yoga. There's a number of different things that have been proposed, and they do seem to help people.
Okay, I think Mona's going to return us back to our regular screen, but big applause. I'm so thrilled that we have this to share with our patient community. It gives such valuable information and really takes the fear out of robotic surgery, I think. It's been mentioned to me a couple of times as a patient, and you know, you kind of hesitate a little bit because there are some scary thoughts about it, I guess. And I guess we might get some questions about that to Dr. Pautler. And there we go. Now we're getting back to normal. So Mona's going to help me with questions in regard to, for Deb. For the audience, if you have a question, you'll see that you have a spot where you can, I have Joanne saying she doesn't have sound. I wonder if we might have a recommendation. Mona, if you could help us with that, what I might be able to suggest. Do you have a microphone, the little microphone icon on the bottom of your screen or on the side of your screen, Joanne? Maybe if you click on that, it might help. I'm not sure. For those in the audience, if you'd like to ask a question, please type it in the question box. If you are on an iPad, it will be on the top right of your screen. And if you are on a desktop computer, it should be in the panel. You'll see a panel to the side of your screen. There will be a place there where you can type your question. And I think there's also a chat box. If all else fails, we might be able to do some questions in there. And yes, Alex, I have a comment from Alex. If you don't mind, that was one of my questions. Could you give a brief overview of the robotics in Canada?
Yeah, so I guess while we wait for some clinical and patient-related questions, and Christine, thanks for the kind introduction and hosting this event, and we're super happy to have partnered with you guys in creating some patient awareness and education content. Currently in Canada, there's about 30 hospitals with systems. The first one was installed in Montreal in 2003, and then I think shortly after there was the next one was installed in London, and in Dr. Pautler and Deborah's territory, and it's been really great to work with them. And there's about 200 surgeons across Canada trained, and there's systems in 5 different provinces.
Wow, that's really interesting. And so you two were in one of the initial hospitals, so you are truly pioneers in robotic surgery in the Canadian landscape. So thank you. I'm not sure if Mona can hear me okay.
Yes, I can.
Oh, okay, Mona, do you have a question for Deb or Dr. Pautler?
I have a question for Deb and Dr. Pautler. They're
Okay.
wondering, you know, what was so important for them to want to share about robotic surgery with everyone here.
Good question. Dr. Pautler, would you mind starting for us?
Sure.
Thank you.
So I think the importance of sharing this information is in part to demystify the allure of the robot. And as a surgeon, in the timing of my career, I learned open surgery, and then we started doing minimally invasive surgery, and then robotics became available. So I've had a career that spanned all these different ways of managing kidney cancers. I get many patients who get referred in who don't really have a concept of what the robot really is. They think it's this autonomous machine that's going to do the surgery, and I'll be sitting in the surgeon's lounge having a coffee and reading the newspaper, and which is simply not how this works. It really is a tool, a highly advanced surgical tool that helps us. Likewise, I also wanted to make sure that patients understood that if you're not having robotic surgery, you're not suddenly missing out on some better or magical aspect to your surgery. There are cases where robotic surgery is absolutely a great choice. There are other cases where no, it isn't. And if your surgeon says it's probably better done open and there's major vascular involvement or other reasons, then you know that you're getting the best type of surgery for your situation. So it was important for me to try to demystify some of these questions and concerns.
Thank you. Deb, you volunteered to be our patient voice in this. So what made you decide to do that?
I wanted to share my story and to let people know what having robotic surgery is like. Yeah, and
it was a positive experience for you?
Yeah. Sorry, excuse me.
No, that's okay.
I work in the operating room, but I've never been involved in the robotic surgery, so that wasn't really an advantage to me, like being a nurse. But I have done laparoscopic surgery, so I kind of had an idea, and I had the opportunity of seeing what the robot looked like. And where Dr. Pautler would sit during the surgery at the console. So it was actually kind of an eye-opener for me, because not having been involved in that kind of surgery before. So I wanted to, I think it's important for people to be aware of what one of the options is for the surgery.
Mhm. I know for me, this was very helpful because sometimes your perception of how the robot is and how the doctor works with the robot, as you said, Dr. Pautler, is there's misconceptions about it. And you're actually, it's all, you work as one big kind of unit. You are the driving force and you are right there all the time. So it is a scare. It is a little bit scary as a patient going into robotic surgery, and you see this gigantic, machine, for lack of a better word. You sometimes wonder how this is all going to work out for you. But I'm so glad that we have this opportunity to see the intricacies of it all. Mona, do you have another specific question?
Yes, I've got two. So we'll start with the first one. Can the Da Vinci robot be used for other minimally invasive surgery? My wife had a full right nephrectomy and adrenal gland, but now has MRCC to lungs. Is robot a future option?
Dr.
So,
Pautler?
yep, so I can take that one. The robot's used for a multitude of different surgeries, and not just in urology, although urology still is one of the leading forces, but in gynecology, general surgery, pediatric surgery, head and neck surgery, and thoracic surgery, so working in the chest cavity. Currently, it's not really being utilized for metastatic renal cancer resections from lung. There are other minimally invasive techniques that can be applied in the appropriate cases. But it's certainly, there's certainly expanding indications for using robotics. And we expect, there are other surgical robots that are being used in hospitals. For example, neurosurgery, for brain surgery, there's a specific robot that came out of Calgary. So there are many moving parts with what's available and what is on the horizon.
Okay. Mona, you mentioned another question?
Yes, we have seen in recovery. What have you seen in recovery times and other side effects between robotic versus other surgeries?
So with the minimally invasive aspect to the robot, the small portals, they tend to heal fast. So people are back on their feet, typically up walking the night of their surgery or the very next morning. Hospital stays tend to be 2 to 3 days shorter. And then the actual recovery time to getting back to work is usually shortened by about 2 to 4 weeks, somewhere in that range.
Oh,
wow. And Deb can tell her story if she cares to. But certainly we see patients who, you're worried about them, they're a bit frail, and because there's less actual tissue damage than compared with an open surgery, they do tend to recover faster.
good. Maybe we could just segue into Deb for just a second. Deb, did you find, I guess you don't have really a comparison, but did you find your recovery, relatively easy? Like, I know no surgery is easy, but as compared to what you might have faced with an open surgery.
Oh yeah, I'm grateful that I was actually able to have the robotic surgery. The surgery was the Tuesday morning, and I went home the Thursday afternoon.
Oh wow!
I didn't remember much on the day of surgery, even the next day. But once I had the catheter and drain removed on the Thursday morning, I went around and enough that they said I could go home. So that was, and then I was back to work 6 weeks after that, and back to full duties 3 weeks after my return. So 9 weeks later, it was full duties.
Wow, that's pretty amazing for major surgery. It's maybe a good thing you didn't remember something for the first couple of days, but generally, were there special things that you needed to do to recover from your surgery? Like like anything specific that you would recommend to other patients, something that you learned going through the experience that you'd like to share that might make their recovery a little bit easier?
I know when I came home, I have a recliner and I spent a lot of time in my recliner. I actually slept in my recliner for a good, like probably 2 weeks. It just made it easier than having to get in and out of a bed. And I'm trying to think what else. For recovery, it's not so much the physical part, but a friend gave me a journal so I could write down things, any questions or any thoughts, just to keep everything in mind. And I bring that when I go for my visits to see Dr. Pautler.
Good.
And anything else at home, get your husband to do as much as possible.
Yes, we always recommend, you know, and especially being moms, they're so used to doing everything, and it's very hard for them sometimes to just take a step back and let people look after them. But that's an important thing to remember. You do need to let people help you. And Deb, it was a great tip about the journal. We highly recommend that for our patients as well. Not only to write down questions as they come along, but your side effects or any difficulties that you have, because we tend to forget or we downplay them. And everything is important in treatment. So Dr. Pautler, I wanted to mention in your video, you mentioned other alternative things to get ready for your surgery. And I am so glad that you mentioned mindfulness and yoga. I feel that we really need to treat the whole patient, the whole person, and mind, body, spirit. And we have to have the right attitude and right place of mind to go into a major surgery like what you do. So nutrition and exercise certainly play a huge part, but we have to treat the other aspects as well. So thank you so much for bringing that up. It's encouraging to our patients to hear that kind of recommendation. Mona, would you happen to have another question?
Yep. Are there any scar tissue concerns that may impact future surgeries?
So with any surgery, there can be internal scar tissue afterwards. So while the small portals allow us to go in with the small robotic instrumentation, what we're doing internally sometimes is as extensive or more extensive than you'd see with open surgery, for example. So scar tissue can occur, and anytime you have to go back in, particularly in the abdomen or in the region around the kidneys, it becomes more difficult each time. So surgeons were prepared for that. That's part of what we do, but it is something that you don't really want to minimize. You don't want to forget about as far as part of your discussion with a person, because complication rates do go up if there's increased scar tissue or it becomes a more difficult surgery. Now, robotic surgery may actually reduce some scar tissue and certainly reduces wound infections, which can lead to scar tissue. So there may be some benefits, although that hasn't really been proven in major trials.
Right.
There's another question, Christine, for Alex.
Yeah, go ahead.
We have sons in engineering, mechanical and civil, and and a niece in engineering as well. What universities are doing robotics R&D? Where was this robot invented, designed, and built? Is it Canadian?
So this robot is not Canadian. It's from California. Intuitive Surgical makes it. But with that said, Intuitive Surgical and Minogue Medical have partnerships with a lot of different universities across Canada. So there are robotics researchers in Edmonton, Vancouver, and London. Ontario has a big program as well. They actually have 3 research full systems at the CSTAR facility, which is pretty amazing. And then there's obviously other robotic programs at every engineering institute. But in terms of Da Vinci specific, kind of partnerships. Those 3 sites are the main ones. I've talked to a lot of engineering students, and so as a mentor, you can connect me directly with them if they have any more specific questions. I could put
That's
my
very
email
nice.
in the chat.
Thanks, Alex.
Another question that's come in. Christine, do we still have time? Yeah.
I think we have a few minutes. Is everybody okay with a couple more questions? Okay, great.
Surgeons scrub their hands. How do you keep the robot free from bacteria?
So the robot actually, so the instrumentation is all sterilized, same as any other surgical instrumentation. So what's touching the patient and going inside the patient is all sterilized, the same as if we were using Metzenbaum scissors or Mayo retractors or whatever for any type of surgery. The robotic cart has sterile drapes that go over top of the arms that come close to the patient. They're actually not touching the patient, but they're close. So those are all sterile as well. And then the remainder is outside of the sterile field of the operation. So it's pretty standard sterilization techniques.
Okay. Mona, have you got another one?
For Deb?
Okay.
Deb, how did you prepare mentally or physically for your surgery?
That's a good question. I continued to work, trying to keep some things normal. So I continued to work as long as possible, but the mental part did take over, and I ended up taking a few extra days off before surgery just to gather my thoughts and to relax. And those are the things that I did beforehand. And after surgery, the mental part still plays an issue. So.
Deb, do you mind me asking how recent was your surgery? It's still pretty fresh, is it not?
Yeah, it'll be 4 years in September, right? Yeah, 4 years September. So what's that? 3 years right now.
Good. Okay, and I'm going to ask one of those patient questions that we recommend. What's your routine, Deb, following surgery? Are you scheduled? I know Dr. Pautler is an excellent doctor, so are you scheduled for checkups every once in a while to make sure that everything is?
Yes, I was every 6 months. You'll have to correct me if I'm wrong there, Dr. Pautler. Every 6 months for 2 years. Is that right?
Close.
Close to that.
We follow the CUA guideline.
Thank you. And do you mind sharing what those are? Just so some of our patients don't get that, so we'd like to make sure they know what to expect.
So a consensus amongst expert uro-oncologists in this field came up with a schema for following patients based on their pathologic stage. So pathologic stage is T1, which it can be A and B, T2, T3, T4, and then any lymph node or metastatic disease. And so this has been published and then revised last year and a half ago. So for T1A, which is the lowest stage of kidney cancer, it's a yearly visit for 6 years and CAT scan at 2 years and 5 years. Each visit has chest x-ray, blood work, and history and physical. I vary from that slightly. I have a slight differentiation than most of my colleagues because I do see the patients at 6 months, as Deb was alluding to, because I think post-operatively, once you see the patient, then say, I'll see you in a year, my personal opinion on that is that's a bit too long. I like to see some blood work. I like to do a renal functional scan for a partial nephrectomy at 6 months, just to keep tabs on the patient a little closer. And then there are variations from the guideline, and that's really based on symptoms. So for example, if Deb had blood in her urine or other symptoms, I may do a CAT scan to investigate that, or I may do other tests that aren't according to the guideline. And the guideline gives the physician that leeway to make those decisions.
Great, thank you so much. It's really good information for our patients because, as you probably are aware, things do vary across the country and, between major centers and regional centers. And we like to make sure that our patients are aware of the guidelines that, should be followed for them following surgery. So thank you for sharing that. Mona, do we have another question? And then maybe we'll move on because we have one more exciting aspect of this evening. And I think that maybe Andrew Weller, our board chair, is now available to join us. So if he is, Andrew, I'll ask you to share your camera and come on with us. Thank you, Andrew. There he is, our board chair of Kidney Cancer Canada. And Mona has a question. Have you got something or?
Yes, I do. Okay, so I have surgery scheduled for March 25th in Vancouver. I love to do cardio. How soon typically can I expect to get back to full exercise?
So that will depend, I guess, on the exact surgery this person's having, as well as any potential operative or post-operative complications or issues. Typical advice is for my patients, as long as everything's gone well, is I want them out and walking, doing increasing amounts of walking over the first couple of weeks. And then by about 4 weeks, building up, if they're doing cardio, then to do it, not high impact, usually low impact cardio. Something like aqua fitness, getting in the pool is very reasonable at a month after surgery. Abdominal crunches and really core exercises, typically about 6 weeks, because even if everything's gone very well, there's still stitches inside that have to heal appropriately. So it would be something to discuss with your surgeon before discharge from hospital and say, how soon can I get back doing some of my activities? There's something that happens after every surgery, and it's something none of us can avoid. Our bodies actually become catabolic. So for about 6 weeks after surgery, our body takes all our energy and focuses it on healing. So no matter how much you have a desire to go out and push yourself, you might not be able to. Having the afternoon nap that you've never had before, those types of things are a natural part of our physiology. So I think the key is having that discussion, and as well, really having appropriate expectations for yourself. Don't push yourself too hard. Certainly exercise is important, being moved in motion. Motion is lotion, which is great after surgery, but common sense also has to play in there.
Thank you, that's wise advice. Just as we kind of wrap up this segment, I'm going to touch base with each of you. Alex, is there anything that you would like to share that we didn't feel that we covered as far as your aspect? Once again, we are so grateful to Minogue Medical and this wonderful collaboration we've had. It's been just a great experience, and I look forward to working with you in the future on your, both of our patient education and engagement going forward to make sure that the information is available and correct for our patient community. Is there anything else you'd like to add?
Yeah, no, and we're totally aligned with that, and it's very important to have the right information. And I'm very happy to everything Dr. Pautler shared and with that video, and Deborah as well. And I guess just if there's any apprehension, there's a lot of materials online to learn more. There's some really great patient animations about what to expect about robotic surgery that really explain what you're going to go through and what the technology is. So I suggest looking into more of those resources as well. And I guess just for people to know, it's been used for 20 years. There's 4 generations of systems, and over 8.5 million people in the world have undergone robotic assisted surgery.
Oh
So
my gosh, really?
it's
Wow.
yeah, it's safe. And there's over 6,000 systems globally being used. So,
Wow. And I do understand that you at Minogue Medical are initiating some patient education sites, and we'll certainly be sharing information so that our patients can access both. So watch our website for that. There'll be further collaboration with Minogue Medical. Thank you, Alex.
great, thanks.
And Deb, is there anything you'd like to share from the patient perspective? Is there anything important that we missed you want to share?
I'm just going to look at my notes for a second here.
Okay, sure.
Just something that I had wanted to say. At the beginning of my journey, like hearing those words that you have cancer, it's really overwhelming. And I know one thing I did, I went to the internet. One good thing about going to the internet was I found Kidney Cancer Canada early on.
Oh, thank
And
you.
yes, I was on there quite a bit, reading things and hearing reading everybody's stories and journeys. The other problem is Dr. Google is not always your friend. So it's good to ask your doctor the questions and develop a good rapport with your doctor and feel comfortable with your doctor. That's a really important part of your journey and to help you get better.
Thank you. That's a very important point. Thank you for bringing that up. And thank you for being our volunteer.
Oh, my pleasure.
Our volunteers are what makes Kidney Cancer Canada. We're so grateful for you for doing that. Thank you. And Dr. Pautler, is there anything that you would like to share that you feel we might have missed and is an important element?
I don't think we really missed anything, but I would echo that KCC is a wonderful resource for patients. And having been a former board member on the medical advisory board, I know there's a lot of people who put heart and soul into this. And I think it's been phenomenal. And you know, this is really a national resource. So yeah, certainly, I think if we can help one person get through their journey, then we've done a good job.
I agree. And thank you so much for your kind words. They're much appreciated. So Andrew, you have joined us. I'm so glad that we figured out these technical difficulties. And I did read your statement at the beginning, but maybe you'd like to just do a brief introduction of yourself. And then we're going to, if Ryan Farrell is joining us. If Ryan, you might turn on your camera while Andrew's having a few words.
Yeah, sorry about that. You'd think after a year we'd solve all these technical issues, but I live in an area with very poor internet and had to reboot halfway through. But anyways, yeah, I got involved in Kidney Cancer Canada years back, just sort of alluding to what Deb said, getting more information and talking to different people. My journey goes back quite a long way. I've been on active surveillance for going over 26 years now. And in fact, Dr. Pautler, when he was a fellow down at the NIH, I think you were a fellow then, I'm not sure what your position was, but he was one of the ones that I remember fondly when I used to go down to the NIH. Well, I still go down to the NIH now every other year, but at the time it was every year. So I've been on active surveillance, and I think this is amazing to have technology like this. So Alex and your team, Minogue Medical, to bring in these Da Vinci robots. Back in the day when I guess I first started going to the NIH, it would have been open surgery, and then it went into laparoscopic surgery, and now we can look forward to these Da Vinci robots to improve the treatment that we can get. I joke with people that I sort of pre-calculated when I'm going to need my surgery, and every year it gets a little bit closer because there's a certain size of a tumor that when I'll be operated on, like depending on what your specific conditions are. So as some of us are, we're on active surveillance, and when the time is right or not so right. But I look forward to being able to use the latest and greatest technology. And it's amazing how the doctors and the medical researchers can come together to bring this new treatment options to us. And building on again what Deborah said, Kidney Cancer Canada has some great resources, and yes, Dr. Google may not be the best place, but we have a list of questions that we've pre-selected that you may want to print off and take to your doctor to help you with making sure that your doctor is giving you the best and optimal information so you can make the choice whether you go on active surveillance, you have robotic surgery, or some other type of treatment, whatever's best in your condition. So thanks everybody for joining.
I'll echo Andrew's comment because I am too on active surveillance for many years now, and I have a great team and I'm so grateful to them, and I guess that's where I'm headed as well. With if all stays status quo, it will be robotic surgery when it's my turn. So this has been very valuable information for me as well. And I would like to take now your attention to our new guest, Ryan Farrell. Ryan is the manager at Rona in Elmsdale, Nova Scotia. Welcome, Ryan. I'm so glad you could join us this evening.
Thanks for having me, everybody.
And Ryan was a very generous help to Kidney Cancer Canada. Lowe's Canada has a Heroes campaign, and this year, Ryan and his staff down there in Elmsdale at the Rona picked Kidney Cancer Canada to be the recipient of their generosity, and we're so grateful. There was a kind of a campaign at the checkout, and please correct me if I'm wrong, Ryan, where you could donate some dollars as you bought your product, and they set up displays in the store and kind of made Kidney Cancer Canada the focus for the month of September. And we were very grateful. They were very generous, and a percentage of the dollars that were raised are going to be donated to the Da Vinci Surgical Unit campaign at the Queen Elizabeth II Hospital in Halifax, which is right next door to Elmsdale, I think. Is that right? Ryan, are you pretty close?
Yep, both 50 kilometers. We're just outside the city.
Very good. They have been doing a fundraising campaign at the hospital there, and I think they're very close to being successful and raising all the dollars needed. So the money that we will be donating, that Ryan and his staff generously raised, will be going there. And we will also be using some of the funding to hold webinars on mindfulness and stress management. We have found that very well received over the past year, especially with COVID. We've had several webinars, and our patients really benefited from what they can offer. And there are two doctors down in Halifax, Dr. Rob Rutledge and Dr. Timothy Walker. They have the Healing Center in Halifax, and we hope to be collaborating. It hasn't been finalized, but we're quite sure that we're going to be able to have some webinars for our patient community across Canada from these two fellows down in Halifax. We have had Dr. Timothy Walker. He was one of the contributors to our national forum before, and that was very well received. So Ryan, thank you so much for picking Kidney Cancer Canada and your generosity, and please extend it to your staff and your community. I just wanted to add that I have been in touch with the foundation at Queen Elizabeth II Hospital down there, and we are going to be able to do some media locally and include Ryan and his store so that they are acknowledged for their work, charitable work. So Ryan will be working in the near future to make that happen.
Some great news.
So,
just happy to be a part of all of it. Thank you.
Yeah, thank you very much. Much appreciated. Ryan, is there anything else you'd like to say, or you're pretty good?
Not really. Just it's an important cause to me personally, my family, and my team at the store. So we're happy to do it.
Very good. Thank you. Well, I think that's it for this evening. Andrew, is there anything else you'd like to contribute, or? I think,
No, just for more information and to join our community, go to kidneycancercanada.ca and sign up and keep in touch with us. We have periodically different webinars. Unfortunately, last year and this coming year, we won't be able to have our in-person forum, but hopefully in 2022, 2023, we'll return to in-person forums. But we'll continue on with these webinars to bring the latest and greatest education and support. Christine and her team also have some very valuable, I think they call them coffee chats now, although they don't get together coffee in person, but they have virtual coffee chats where different patients and different caregivers can get together and talk about what their journey's like, whether they're going into surgery or they've had surgery or they're on some chemotherapy treatment. But there's a great network of patients out there, and some of them are facilitated. Other ones, patients just get together and talk about their side effects or treatment management, and it's great resources for you all.
Thank you, Andrew. I'm going to actually make one more comment. We are very excited at Kidney Cancer Canada. This is kind of another first for us. To celebrate World Kidney Day, we are in the Maclean's magazine that hit the newsstands today. They have a special cancer health section in this month's magazine, and we do have a half page in there. So if you happen to see a Maclean's, please pick it up and have a look. And we also are in their digital Health Insights magazine. Both those links will be on our website, so you can click on there, and very soon Dr. Pautler and his videos will be in our video knowledge library. And Deb, I'm going to tell everyone where they can see yours on our website. If you go into news and events and past meetings, and Deb, we're going to have Deb's full video, which actually looks just as good as Dr. Pautler's. So I hope that you'll take advantage and tune in and see other comments that Deb made as well. So once again, thank you so much for joining us this evening, and all the best to you. Take care. Be safe out there. Good health. Night.
Thank you. Good night.
Thank you, everyone.
Thanks, everyone.
Thank you. Have a great night.
Good night.
Okay, Mona. Thank you, Mona.
Welcome.